changes us. Literally, it causes a chemical change in our DNA. And this changes the way our genes function, sometimes for generations. Technically, after a trauma, a chemical tag will attach to the DNA and tell the cell to use or ignore a particular gene.
Okay.
And then the way the genes are affected will change how we act or feel. For example, we can become reactive or overly sensitive or affected to situations that are similar to the original trauma that our parents and grandparents experience, or so we can deal with it better. And these gene changes that we're learning, this is what's transmitted to our children. I'll give you an idea. If our grandparents came from a war-torn country with arrests and bullets and explosions and maybe people gathered into the square and people shot, they would develop a skill set to deal with these things. An epigenetic change, for example, sharper reflexes might be one, or quicker reaction times to help them survive this trauma. Now, the problem is they're going to pass this forward to us, which is a great skill set.
Yeah.
You know, now we have this hyper alert, hyper aroused ability to navigate trauma. But the problem is we're also inheriting a stress response with the dial set to 10, prepared for a catastrophe that in our life never arrives. In other words, we're born with fears and feelings and anxieties that originated with our parents and grandparents. And we think these feelings are ours, and we don't make the link. That's the problem. We don't even think to make this link. We're not born with this clean hard drive that we think we are. To use a computer analogy, there's an operating system already in place that contains the fallout of our parents and grandparents' traumas. And then our traumas, our